I'm Brittany, and this is the STARS Emergency Link Center. The Emergency Link Center started in 1996, and our first call was received on April 12th. STARS Emergency Link Center was funded from CAP, and prior to the ELC, calls for STARS were received on a cell phone and were answered by the pilots, the medical crew, and physicians, basically whoever was closest to the phone. Some of the job functions that we do here in the ELC is Red Patient Referral Coordination. STARS and Alberta Health Services agreements started April 2010. STARS and Saskatchewan Health Agreement commenced in 2012, and we build conferences that include stakeholders, collaboration, not command and control. We also do online medical control for the province of Alberta. So this is a result of an affiliation agreement with Alberta Health Services. The live date started December 1st, 2010. Physicians are on call and they provide support to field EMS practitioners as indicated by MCG. Another one is Industry Site Emergency Coordination. So we provide access to public safety agencies. Additional expertise of STARS physicians is needed. STARS helicopters dispatched at the discretion of the physician and Neighbor Helping Neighbor program. We also do STARS helicopter coordination. So key ELC roles in helicopter missions are flight following, ERP activation, and facilitation of STARS requests. Other responsibilities are securing landing zones, building radio patches for patient information for receiving hospitals, and other communication facilitation. Industry site registration is another job function that we're responsible for in the Emergency Link Center. We support companies in emergency preparedness. Information collected is useful in an emergency situation, and registering helps public safety find the patient more effectively. Industry Emergency Contact Center started in 2009. 3 companies in total with support service for a 4th. We answer emergency lines as provided, access to the appropriate contact person within each company for specific circumstances. And we have customized protocols for each company. Currently, we are responsible for Synovus, Encana, Taka North Husky, and currently it's Cinetrac. Work alone monitoring agreement with Synovus started in 2011. Contact point for work alone in the field and access to Synovus emergency protocol situations where the worker does not check in. For the helicopter service areas for flight circles, there is approximately a 250-kilometer radius around each base. So currently our bases are Calgary, Edmonton, Grand Prairie, Regina, Saskatoon, and Winnipeg. The AW is anticipated to increase the range by approximately 25%. Technology that we use here in the Link Center is a computer-aided dispatch, which we call CAD. We use radio, telephone system, alternate telephone systems, voice recorder, Google Earth, and Skyweb. And key ELC partnerships include energy industry, producer, service companies, medical providers. With Alberta Health Services, we are involved with Rapid, Information and Destination, EMS dispatch centers, and local EMS responders. With Saskatchewan Health, we work with SAA, Bedline, ACAL, and WAD. And BC Health, we work with BC Air, BC Bedline, and BC Ambulance Services.
Okay.
Any questions?
We'll have to update that when they call in, because if something were to happen, it would be emergency.
Okay.
You can take one step over.
Okay.
Yeah, that's perfect.
Okay, tell me when you're ready.
Whenever you are.
So the STARS Emergency Link Center is a 24/7 operation. We always have 6 employees on in the day, and at nighttime we have 3 full-time employees. So we work 4 on, 4 off. We work 2 12-hour days and 2 12-hour nights. This is the workstation that we use here to facilitate all the calls that come into the Link Center. So this is our agency list here, where we have thousands of numbers, where we basically have every hospital, every physician, on-call people, employees of STARS. So if we need to get in contact with anyone, we can get a hold of them immediately. We have our response details right here. So when the call comes in initially, this is where we put the details of the call in. So we choose the call type, whether it be an interhospital, a scene, an industry emerge, Encana, Synovus, or Husky emergency. We're able to choose the call type, which will drive the protocols that flow us through the call. We also gather the location of the emergency, physicians involved, paramedics involved, basically anybody who is on the line, we would put them in this initial information. This part of the CAD right here is the most important, and this is where all of our helicopters are listed. So right now we have star 1 through 11. We also have all of our industry responses on here. So we have Synovus in Canada, TACA North, Cinepec, and Husky on there. And we have also our OLMC. We use this to track the aircraft. So for example, we have Camrose. Star 4 is doing a training flight for Camrose, so we know that they're dispatched to not skids up. When we have multiple aircrafts in the air, we mark their statuses. So if they're up responding, if they're down patient, or if they're up from the scene, we mark every status that they're on, so that way everyone in the room knows exactly where the aircraft is at the time. The bottom call here is when we select the calls to put all our notes in. So as you can see, all the notes are in the call right here, and we use these so all of our partners know what's going on with the call. With 5 aircrafts right now, it's not uncommon for all the communication specialists to be on the phone at the same time. So we use the notes to be able to communicate with each other, and we have to read it like a story. So if I can't talk to my partners on either side of the room, I'm able to read the notes and know exactly what's going on with the call. So everything needs to be documented. This is our map right here that we use. This mapping system is quite detailed, and it has every single town, hamlet, common meeting place, road intersection, highway in BC, Alberta, Saskatchewan in here right now. We use this to verify the location of where the hospital is or where the scene is, so that way we can give the exact coordinates of the scene or the hospital or the location to the crew involved. For example, if I was to search a highway provided by the requester or the hospital, I'm going to use Highway 2 and Highway 27 right now. And it just pulls it up here, and we would go by the county based on the information that's given to us. And the map will validate right there exactly where the location is. So if this was a scene call, for example, I would be able to validate the location, confirm that this is in star 1's flight circle, and I would be able to get the coordinates where at the bottom of the screen right here. The reason that we get the coordinates and the location is so we can give those coordinates to the pilot so they can check weather. So we basically have all this so we can help the crews out and give them the information. We're also able to provide flight times to the crews or people responding as well. So we're able to measure in nautical miles, kilometers, anything that's given. The helicopter flies 2 nautical miles a minute. So if the requester was asking how long it would take stars to get to scene, I'd be able to tell them it's a 20-minute flight based on the fact that it's 40 nautical miles from our base to that scene. What else? The other things that we do when we're processing calls is get all the information possible. The reason that we do this is because we're the link from the STARS crew, aviation and AMC, to the people on the other end of the line, and vice versa. So we gather all the information from them, and we make sure all that information is passed along to our crew. If the crew has information that needs to be passed along to the requesters or the people responding or the sending hospitals, we can give that information to them. So it's basically our job to know everything that's going on, and if we don't have the information, we'll find a way to get it to them. People dealing with the patient are incredibly busy, and our STARS crew is incredibly busy. So if they have a link center that they can contact, then they can come through us, which saves them some time and energy, and they can put more focus onto what they need to be doing. This is our SkyWeb system right here, and this is where we track all the aircrafts when they're in the air. So the program, when the helicopter's gone skids up, updates once per minute. So every time an aircraft is in the air, our timer goes off every 15 minutes. The reason that we do this is that we flight follow the aircrafts to make sure that we always know where they are. So when the timer goes off, we're able to pull up which aircraft is in the air and determine their exact location. Another thing we do with this is set an ETA so we know how long it's going to be for them at a hospital, so we can make sure the landing zone is secure, or the people who are on scene have all the information, and we can give them the time as well. If you see, we have a number of programs here. Charter Call is another program that we utilize, and this is for inter-hospital calls. So anytime a patient's in a rural hospital going to a higher tertiary care. This hospital, or Chart of Call, gives us all the times for transport within the province. I need to edit that out.
Yeah.
So this program right here gives us all the times for transport options. So we have fixed wing, we have ground ambulance, and we have the STARS time. So we have the out-of-hospital time, time to patient, and total tertiary care. Total tertiary care is all the times provided. So when we're dealing with interfacility calls, which is hospital to hospital, the physicians will most often ask for these times to help them decide what's going to be the best option for the patient and what's going to be the fastest care for the patient. So the biggest difference between a scene call and an interhospital call is that a scene call, if a requester is asking for us to launch and weather's good, we'll go ahead and launch. Or if the requester is asking for a standby and medical thinks we should be launching, then we'll launch. We don't need to involve the STARS transport physician. When we're dealing with a hospital call, the physician is always involved, and they make the transport decision, and they're responsible for that call from the time they get it to the time that the patient's in the hospital. So whether the patient goes by STARS, fixed wing, or ground ambulance, our STARS physician is responsible for that patient, and we always make sure we know where the patient is. So we hold on to the call from start to finish. We have on-call physicians. This is our crew manifest right here. So if you're wondering, well, how do we know who the doctor is that we get a hold of? At every base, we have a set of physicians who are on call. So we know what time they're on call and how we can get a hold of them. So they're very efficient. They most often answer their phones. So we always have someone we can get a hold of when we're dealing with an emergency. When we're dealing with site registration, which I discussed earlier, this is our site registration program. So what people can do is oil and gas companies, or basically whichever, if you're camping or anything you want, you can register a site with STARS for $6 a day. And by registering a site and paying this fee, you have a site set up with our Link Center. So we have all of your contact information, the exact location of where you're going to be, any hazards on scene. We know who the closest EMS unit's going to be, how long they are from the nearest hospital, and all the contact information. So in the case that there is ever an emergency, the people on the site can call us directly, and we can get local 911 on the line. We can get the emergency contacts listed on the line, our STARS transport physician if it's appropriate, and basically anything that's going to help get care to this patient. So just because the site is registered with STARS doesn't necessarily mean that STARS will go on the flight. That's up to our transport physician, and that's based on the availability of the aircraft and weather. But we are involved. And currently we have just under 5,000 sites registered, and that number can fluctuate every day. But we do have 2 call coordinators right over here, and they're responsible for registering and editing these sites 7 days a week. And we also take the overflow calls for them as well. So if you can imagine, there's under 5,000 sites registered. There's a lot of editing happening, and the reason that people edit the sites is so we constantly know exactly where they are. So in the case there is an emergency, we always know where they are, what aircraft we're alerting, and what transport physician we're going to be bringing onto the call. So that's just an overall view of what we do here in the Link Center. It is a lot of multitasking taking place. If you can imagine, there's one person always on the phone processing the calls, and then our team members help with speaking on the radio. So right now, you don't hear anything because there's no aircrafts in the air. But again, we have 5 bases, so it's not uncommon to have 5 consults going on or even more. And you've got the aircrafts in the air, people speaking on the radio, multiple phone calls going on our phone system here, so it can get quite busy, but that's what we have the training here for. So I hope this gives you a little bit of a better idea of what we do here in the Link Center, and please feel free to come up and visit anytime. Yay!
Good job.